Hello, everyone. A great big welcome to you, and thank you so much for joining us for the virtual Canada Health Infoway Partnership Series. I'm Suhanna Marchand. A really challenging and wonderful 90 minutes planned for you, some fantastic speakers, and a chance as well for you to participate. There will be some time, I hope, for Q&A, so get your coffee or whatever it is you're drinking. I've got Rosie the Riveter. We can do it. And maybe that should be the theme of this series. We can do it, but she's joining me for this. And we do have attendees participating from across Canada and the globe. And I'd like to take these opening moments together to acknowledge that the lands on which we are hosting this event include the traditional territories of many nations. Canada Health Infoway recognizes that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health, continue to affect their well-being. Canada Health Infoway respects that Indigenous peoples have rich cultural and traditional practices that have been known to improve health outcomes. So I guess what I'm doing is inviting all of you as attendees to reflect on the territories you are calling in from as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and also contributing to reconciliation. As host of a national news program, I have the great privilege of covering lead stories, interviewing newsmakers from across the country. And of course, right now, much of our coverage, of course, centers on the pandemic. And it has really put the focus on our health and our healthcare system. We have given a lot of thought to how we provide that health and how we maintain our health. And there are lots of questions about this. What is the role that virtual healthcare will play in that big picture? How do we build trust? How do we bring down barriers? How do we make things more equitable in the future as we move beyond this pandemic? And I'm crossing my fingers. I know that one day we will. But those are questions we'll tackle today. I think it'll be a great conversation that, as I say, you can as well participate in. Before we get to the first speaker, I do have a couple of notes to share with you. We have simultaneous interpretation available for all Infoway Partnership Series sessions. So to listen to the session in French, just follow the instructions on the screen. You can also, by the way, find these instructions listed under the General Information tab. It's on the event platform. We also, as you can see on your screen, have closed captioning services available. So to enable closed captioning in English, simply select that CC button on the bottom right of your video player. The virtual Infoway Partnership Series is also very proud to be patients included. And Infoway will continue to convene events which adhere to the accreditation. The patient advisor for this June 15th Partnership Series is Sarah Hamilton. So Sarah, welcome to you, and so glad you could be with us. Sarah has been an advisor for the overall program development, and a great big sincere thank you from the team at Canada Health Infoway for your support, and I know that will continue as well. Just before I move on to the first session of the agenda, a few quick notes I'd like to cover. You can check out the polls, and I urge you to do that. You can share your experiences. You can find live polls on the right-hand side of the main stage video stream. We have planned to allow, as I mentioned, for questions. So this is the participation that I was talking about at the conclusion of some of the presentations, if time permits, and I'm hoping it will. So you can submit your questions throughout the program via that Q&A box, and you see it on your screen right now. Again, it is under the main stage video stream. And at the conclusion of today's broadcast, you know what, take a few moments, okay? And this is a big ask, but share your event feedback. You know how hard it is to get people to send their feedback, but it's really important because it can make the sessions that are coming up throughout the next few months better for you. Put in the thoughts that you would like to see more of, less of. Maybe it's less of me. I don't know. But be gentle if you're going to put in that suggestion. You can find the survey at the right-hand side of the screen. We also welcome you to engage with your fellow event attendees in the platform chat. So you can find the chat by clicking on the blue talk bubble icon. It's at the bottom right-hand corner of the screen. We've got that big arrow pointing to it. And the chat can be used in two ways. It can be used to share your comments with all attendees, or maybe you'd like to just have a private chat. You can message specific attendees directly. So lots of ways to communicate. Even though you might be in your office, you might be in your kitchen, I'm in my living room, we're doing this virtually, but we can still communicate with one another. So you're antsy to get onto the program. Let's do that right now. It is my pleasure to introduce Jackie Steer, patient partner, and Sheila Maloney, Executive Vice President, Engagement and Marketing at Canada Health Infoway.
So Hannah, that was a great introduction, and we're really looking forward to spending this next couple of hours with you. I'm Sheila Maloney. I am the Executive Vice President responsible for engagement and marketing at Canada Health Infoway, and I want to welcome you to this session, our third of six partnership sessions that will be running over the course of the summer and fall. And we really want to talk to you today about patient and digital health literacy, and we're really excited about this conversation. Before we dig into that, though, what I'd like to do is play a short video for you. This is sort of for those of you who are maybe not be as familiar with Canada Health Infoway, or for those of you who are familiar, this I think is our worldwide debut of this Infoway video. So let's take a minute and watch it now, and let us know what you think.
All around them, Canadians are experiencing wonderful improvements. Almost every facet of our lives has been reimagined to be more effective, more efficient, more affordable, and more personalized. Every category has been completely reimagined. But what about healthcare? What does the future of healthcare look like? Well, it's a collection of interdependent stakeholders like healthcare providers, system administrators, governments, and industry. The challenge in reimagining healthcare isn't just the complexity of the system, it's also the cohesion between the players in it. At the service of Canada's health systems, we're here to help with that cohesion. We're Canada Health Infoway. We're driven by the belief that a more connected and collaborative healthcare system is a healthier system. We work to help integrate digital health into the Canadian healthcare experience. With our partners, we unlock more efficient and accessible models of care. We facilitate faster, more seamless, and secure information sharing. Most importantly, our collaboration with stakeholders helps create better healthcare outcomes for all Canadians. Information is shared, innovation is amplified, inspiration is spread, and patients are engaged. That's a future worth creating. And everyone at Infoway is proud to play a role to help create it. Let's not just reimagine healthcare, let's build it together.
Great. So let's jump right in. Patient digital health literacy. And when I say patients, I should say patients, families, and caregivers. We've shortened it just for brevity. So why are we doing this? I guess there's two main drivers of why we're doing it and why we're doing it now. First of all, COVID-19, as you know, has certainly progressed and accelerated the use of virtual care across Canada. In fact, in 2021, 57% of all primary care visits are done virtually right now. So that's one driver. We need to make sure that we get this right. But the other, reason why we're doing this is because it's in reaction to some surveys we've done of Canadians. So last year we launched the largest national public health consultation around digital health, and we reached about 58,000 Canadians, and we asked them questions about healthcare and technology and use of it. And so here's what we know. We know that Canadians are very comfortable with the use of technology. They know that it's improved many aspects of their lives. They want it to improve health as another aspect of their lives. Those who have had a virtual visit are 92% of them like the experience that they've had. They want technology to solve their problems. However, 26% of Canadians said they didn't have access to reliable enough internet that would allow them to have a virtual visit. 4 in 10 Canadians report that their level of understanding of health information is a barrier for them. They either don't understand the technology, they're not comfortable with the information that's shared, and 6 in 10 don't really know enough what apps to look for and where to get them and doing that. So that was a real impetus and driver for why we're doing this initiative. So the next slide talks a little bit about what we're doing. And so you'll see that when the next slide comes up. Here's our goal. It's really, at the end of the day, we want to develop digital health literacy tools that Canadians can use. We want to make sure that they have the right information at the right time, at the right format, that will really help them improve the healthcare that they have. And so, how are we going to do that? And when are we going to do it? Well, I'll tell you a little bit about that in the next slide, when we talk about what our timelines are. And so we know that with this mandate in particular, we started this initiative. So we can go to the next slide, please. The initiative started in early this year, so in sort of March, April 2021. And we have a mandate from Health Canada and funding for this initiative until March 2022. So in that time, what we'd like to do is build the program with the base and the foundation and the fundamentals of the program, and start in this sort of limited time that we have. A year is a long time or a short time, depending on what you're doing. We think this is a fairly short amount of time that we've got. So we want to take the priority areas and build an initial set of materials that, again, is part of a larger framework or program that we want to develop. And so the next slide talks a little bit about the most important piece of this project, and that's obviously patient and digital health literacy needs to start and end and include patients in every aspect. So one of the very first things we did was we went out and conducted interviews, we did focus groups, so very much asking Canadians what they want, what they need, what they're looking for in this. So very much looking at different ways that we can collaborate, work together, and make sure that we develop a program that is consistent with and meets the needs of Canadians. We're also, as we're doing this and as we're doing our surveys and interview work, we are mindful of trying to make this inclusive for all Canadians. So looking at diverse populations and getting their needs and including them in the environmental scan and the needs assessment, et cetera. I should also mention that this project is being done in a parallel stream of going on is a clinical change management project. So we know that relationships with patients and clinicians are really important. So we want to make sure that not only do patients have the needs and the tools that they want and need to make their virtual care more successful, but we're also at the same time working with clinicians to provide them with change management tools to make sure that their virtual care experience with their patients is at optimal. So at the end of the day, we want to include patients and clinicians in this. On the patient stream, we've been very collaborative and really want to work with our patient partners. And so I'll tell you, in the needs assessment and the focus groups we've done so far, a couple of key messages have come through. So first of all, it's, develop this program so it's relevant to me, make it accessible to me, do it in the formats that are accessible, that I want them in, and use the channels that currently exist. Whether it's for a church group or a community center or through a patient association that currently exists. That's what we're hearing so far. We really want to be true to that. So, and that's a great segue. So I want to go and introduce our patient partner in one of this projects, Jackie. And Jackie's going to now talk to you a little bit about what goes on from here and introduce something to you today. It was another way that you can help engage in this process. So over to you, Jackie.
Thank you, Sheila. That was great to hear. As Sheila mentioned, my name is Jackie Steer, and as a retired principal assisting my parents to live independently, an equity and diversity champion, and someone who's interested in reclaiming agency of my own health, finding a way to know more about virtual care only made sense. Joining as a patient partner on Infoway's digital health literacy project, I've not only been able to contribute my lived experience, but also learn more about what digital health can do for me, my family, and my friends. I can begin to see my digital health wants and needs being actioned into our work, and it's very exciting. If you'd like to share your thoughts on this important initiative, we'll be providing a link to our national survey during this session, open until June 28th. You can find the survey on the right-hand side of your screen via the Engagement Hub. If you'd like to explore becoming a patient partner with Infoway, becoming an active participant in this literacy work, or even just wanting to learn more, you can do so by reaching out to Haley Armstrong, and her contact details will be available via the Engagement Hub as well. Now back to Sheila to conclude our presentation today.
Thank you, Jackie. Thanks so much. And I really encourage you to participate in the survey, give us help and feedback, and we really do want to hear from you. Haley, we're standing by the phones, and I think it'll be an excellent session, and we're looking forward to your feedback and encourage you strongly to complete the survey and give us your feedback in any way you can. So thank you so much. That concludes our part of the presentation, and we'll back to you, Suhana.
Thanks so much for that, Sheila, and for Jackie for sharing your thoughts and where you see this going, and also how you see it playing out. And that is with people getting involved. So that feedback you were looking for in the survey, I hope that is taken to heart. We'll go directly into the next presentation on the agenda. It is my great pleasure to introduce you to Dr. Arjumand Siddiqui, Professor and Division Head of Epidemiology, Dalla Lana School of Public Health, University of Toronto, and Adjunct Professor, University of North Carolina, Chapel Hill and Research Affiliate, and National Center for Children and Families, Columbia University. By the way, my daughter just got into Columbia, so I'm very excited. I'll be listening very closely to Dr. Siddiqui. Unfortunately, however, Arjumand was unable to join us live, at least live virtually, you know what I mean, but she has shared her presentation. So here is Dr. Arjumand Siddiqui.
I'm grateful to Infoway for allowing me to pre-record this lecture and be able to share some thoughts with you. So I'm going to talk to you a little bit today about the context of healthcare in general, and the role of healthcare in producing health equity. And this lecture doesn't really talk about digital health per se, but it kind of sets the context in terms of why good access to healthcare is important, and therefore why digital health is important to understand in the context of health equity. This is a picture of 3 of the first people who passed away from COVID in the Toronto area. And as you can see, each of these people are from racialized groups. And these people were also personal support workers. And so when this sort of series of media reports started coming out in early COVID times, people started to wonder whether this was more than just isolated media reports and whether there was really a pattern emerging here of who was more susceptible to die from COVID-19. After some time, as statistics started to be gathered, it indeed became clear that it was systematic, that it wasn't just isolated media reports. This is data from Toronto demonstrating the distribution of COVID-19 cases across different racialized groups in Toronto. And the gray bars indicate the proportion of each ethnic group that accounts for the total proportion of the total number of COVID cases. And the green bars are the proportion of that ethnic group in the Toronto population. So for example, second from the left, you'll see that Black people account for 20% of COVID cases, even though they represent only 9% of the population of Toronto. And there are other groups that are also overrepresented as a proportion of their population, while whites on the far end are underrepresented amongst COVID cases as a proportion of their population. We also see similar findings in Montreal on the left-hand side, we see that the proportion of Black residents in a neighborhood is correlated with the proportion of COVID cases. This is also true on the right-hand side for the proportion of South Asian residents, but at much lower levels and with a much less steep difference across neighborhoods. Ultimately, this racial patterning is also related to income patterning, which we've also seen. Again, the gray bars represent the proportion of each income group that accounts for COVID cases, and the green bars represent the true proportion of that income group in the Toronto population. So again, on the left-hand side, the gray bars outsizing the green bars indicate that those low-income groups are overrepresented amongst COVID cases compared to the right-hand side, where the highest income groups are underrepresented compared to their size of the population. And we have a fairly strong body of research that tells us what this is all about. And essentially, if you sort of look at this framework, it gives you a sense of what's going on. And if you start on the right-hand side with health and health inequities, including COVID-19, but certainly not limited to COVID-19, you can see that health is produced by a variety of mechanisms that we probably all kind of know about. Things like your health behaviors, whether or not you have stress, whether or not you can access healthcare, whether or not you're exposed to carcinogens. And that those kinds of pathways that lead to health are ultimately distributed, facilitated, or inhibited by what kind of resources you have in order to kind of keep yourself healthy or be exposed to sickness. And that itself is a result of your social position in society, things like your socioeconomic status, your race, your gender, your immigrant status. So in other words, these kinds of social determinants are essentially producing either a healthy lifestyle or an unhealthy lifestyle. And so they're conditioning the kinds of health that we have access to. And so one of these pathways is access to healthcare, right? So it's not the only pathway that matters for producing health, but it certainly is one. In other words, if we were to think about what makes us sick in the first place and why we have health inequities in the first place, that's probably more related to the fact that race, income, et cetera, condition whether or not we have opportunities for positive health behaviors, how much stress we have in our lives, and so on. And access to healthcare tends to come in a little bit down the line. It comes in terms of how sick we get, whether we can get well, and how we sort of are able to manage our health outcomes. And I think one thing that's happened during the COVID-19 era is that there's this question that's been out there about whether inequities are really related to differences in access to healthcare, given that we have a universal healthcare system, or whether the issue is really hesitancy, for instance, vaccine hesitancy in the case of COVID-19, on the part of patients who come from disadvantaged groups. Is it just that they don't want or are reluctant to receive healthcare? So if you look at StatsCan data on vaccine hesitancy, you can see across ethnic groups, for example, that indeed you have a much lower percentage of Black people who reported being willing to receive the vaccine, about 56%. But the problem with looking at that statistic in isolation is that it doesn't tell the whole story. Here we have the results broken down by age a little bit more. And if you look at Blacks again, indeed, in the 12 to 64 age group, you see that sort of same just above 50% reporting they'd be willing to get the vaccine. But take a look at what's happening in the over 65 category. It actually is a greater percentage than the overall quote unquote visible minority population. And so it's really important not to use very simple statistics to try to understand these issues and try to really get more at the heart of what's happening. When we look at what happened during the COVID-19 era and what's happening, now, when vaccine clinics were created that were responsive to Black people's needs, they were very well utilized. So this is an example of a poster from a pop-up clinic that was created by the Jamaican Association and did very well in terms of vaccinating a very, very high percentage of Black people. So in other words, it really is true that the overwhelming issue is access to care and not reluctance to care, a reluctance to receive care, even though, on another day with more time, I could go into why reluctance, given the context of discrimination, makes sense as well. But essentially what we're dealing with in large effect is really the issue of access to sufficient and quality care. A great example, going back to one of these cases, Mr. Rodriguez, who unfortunately passed away, did go to the emergency room with symptoms and was told to go home and later died at home. So the question is, would something like this kind of an access issue be systemic or not in the Canadian context, given universal health care? Well, I think we're realizing that indeed it may very well be a systemic issue. Our biggest problem is that we don't have a lot of data about this. But the Ontario Human Rights Commission is looking into this and taking this very seriously. In other words, even in the context of universal health care, we certainly have a lot to reflect on and probably a lot of work to do. And I think that's something that Ms. Shaw will talk to you about a little bit later. So in sum, I kind of just wanted to point out how important it is to think about access to healthcare. And I think the conversation about digital health and digital health literacy is really a really good one to have, because the fact that this is a technology that is unfolding means that it could be used in order to make access better for people from disadvantaged groups. Now, it could be used in ways that actually negate their access as well. And hopefully that's not the direction we go in. But in order to go in a positive direction and make digital health something that actually improves access to care and reduces health inequities, I think we need to take a very serious look at how we do it and listen to the people who have experience with it and what they are sort of seeing as they see aspects of digital health unfold. And with that, I will leave it there and wish you all the very best for the rest of the day. And hopefully I can catch up and hear about the wonderful conversation. Take care.
That was Dr. Arjumand Siddiqui. So thank you very much, Dr. Siddiqui, for that. And speaking of going to the people who are on the front lines, those who are, going to be speaking with patients, with people who are trying to access care, I'd like to now welcome Tamika Shaw. She is a primary care services manager at Taibu Community Health Center, and she can tell us about Taibu's experience with digital access and how virtual care is unfolding in that community. And I should also mention that I'm going to join Tamika back on screen for a Q&A. She's got a short presentation, but if you do have questions for Tamika, that she can touch on through her experiences, submit them throughout the presentations. We'll try to get through as many as we can. But here is Tamika Shaw. Hi, Tamika.
Thank you for that lovely introduction, Suhana. It's a pleasure to be here, and thanks to Dr. Siddiqui for giving us that very thorough overview and for setting the stage for us to have a discussion, the discussion for the rest of our session. And so just to give a bit of background for those who are not aware, Taibu Community Health Center is a CHC that's located in Scarborough, and we have two priority populations. We have a geographic catchment, and so we provide primary care services as well as health promotion programs to anyone within our geographic catchment of Malvern. Our secondary mandate is to provide primary care services as well as develop health promotion programs to the Black community across the Greater Toronto area. So yes, it is a pleasure to be here, and I'm hoping that we can provide some of our experiences at Taibu with regards to implementing virtual care, and that can be learnings for everyone who's participating today. So I do have a few slides just to give you an overview of where we were before the pandemic and where we are right now. And one of the key pieces that I really wanted to show, and I think it's the same across the board for everyone, is that we do have access to virtual care tools, and we already had the access. As an organization, in terms of an organization perspective, we just were not using the tools in patient care as much as we could. And so the first slide that you're looking at, it's just a really rough line graph based on data from our EMR that's showing the shift in care. And as with all primary care settings, majority of our care would have been in person prior to the pandemic. And then you can see right around that mid-March, April mark, that's where the lines tend to shift and where we shifted to primarily phone encounters. Now, as my next slide will show, virtual care itself, the uptake wasn't always as, wasn't the same across the discipline, if you will. And this is if we're thinking of organizational capacity. So having the platform to provide virtual tools via Ontario Telemedicine Network, having digital or virtual visits embedded within our EMR, using text messages as reminders, et cetera, even though we had those capabilities, the uptake varied across providers and discipline, and as well varied amongst our client population as would be expected. So if we were to look at the subset of our population that we defined as having capacity, and capacity for us meant they said they were comfortable doing a video visit, they had email addresses, knew how to check their email, and would be able to access a link to a video visit. Even when those were offered, or that option was offered to clients who were assessed to having that capability, most often a phone appointment was the first choice for virtual care. So across the spectrum, from a provider level and from a client level, it goes to show that there needs to be something addressed there, whether that's education, change management, and maybe exploring barriers on both the provider and the patient side in increasing the uptake of different platforms in virtual care. So the really tiny line that you're seeing around that February mark is that uptake of more video visits, but it was really slow to catch on, given that we had the capacity to do so since April 2020. The pickup didn't take off until February 2021. And even then, we're still around 1% of our total clinical encounters for the year. 1% of that would be attributed to video visits. So my next slide will show, it's basically a snapshot of what Taibu represents and the people that come to Taibu. So this is a picture for a laughter yoga group. And what you see is connections. You see a vibrant group, highly passionate, and this is pre-pandemic. What we wanted, or what we felt we needed to do was to recreate a similar scenario within virtual platforms during the pandemic. So my next slide will show, this is specific now to our community group. So my next slide will show, again, pre-pandemic events and during, or I would love to be able to say post-pandemic, but we're deep within. And right around that mark, you'll be able to see where COVID-19 hit, and all our group programs, because these are specific to groups, whether that would be prenatal groups, mental health programs, or youth groups, and so on. And so all groups ceased, as with public health recommendations. And then by May, June, groups started to organize themselves again. So again, people from that same photo that I just showed you, they're initiators, right? They're self-starters, very proactive. And way before COVID-19 was a part of our language. There was a group of seniors who took the onus on themselves to say they wanted to build their computer literacy skills. They wanted to be able to receive information by email from our center, so whether that would be our newsletters or program information based on calendar events each month. And so they created an intergenerational program with our youth group. And so they would meet at the local library, and youth would assist the seniors with creating email addresses, checking email, just being able to navigate the technical space. And so these same groups were able to translate that and adapt in the pandemic. And they were able to then adapt to using, online platforms, video platforms like Zoom to create their groups. So what I find very telling with this slide is, if you notice towards the end, much of our group encounters or the number of groups that are being run are actually double and triple what would have taken place pre-pandemic. And, in terms of Dr. Siddiqui's presentation, digital access and digital health literacy can either be a help or a hindrance, depending on how it's designed. And so for this slide, the key messages I really want the group to take away is, if people are involved in the solutions, and if people are able to create their content, if the content is culturally safe or the environment is culturally safe, if the environment comes from them and there's community engagement, you will get uptake and utilization. If people have access and they have the know-how, and when I say know-how, we're talking just being able to navigate, feeling safe, being able to tell what's safe technology or safe links, and if they feel safe in that regard and everything else is culturally relevant, then you'll see that there is uptake, and the uptake in this instance has been significant. So with that being said, my next slide is just a few anecdotes with regards to addressing social determinants of health. And through funding, through partnerships, we were able to provide access in the form of laptops and smartphones to some of our clients who identified as having a need. And these are some of their testimonies, some of the statements that they've written back to the various staff who've encountered them, is being able to connect with family, or being able to continue the volunteer work that they've committed to doing. And that volunteer work, as I mentioned, is being peer leader within their groups, or running other peer-led programs, such as our chronic disease or chronic pain program. For some people, it was just being able to have a device where they could do work, or their children could access their online classes when schools went to virtual learning. So many different areas that you can see digital access as well as digital health literacy can overcome, or at least lessen the divide in terms of health disparities and outcomes. And that would be the end of my experience. For the rest of the conversation, I'd like to add more high-level information if possible, and to add on to what Dr. Siddiqui presented. I'm also open to taking questions if they're available.
Thank you so much for that, Tamika. It sounds like you're doing great work at Taibu, and Sheila, we heard her use those words, connection and collaboration. It seems that is also one of the successful things, the platforms that you have been able to grow upon at Taibu. I do want to come back to this access though, and while your community center helps to provide laptops to those who need them and need that connection, it can't be the case everywhere. So how do we make access virtually better? How do we improve it? And is that just about education and literacy?
So education and literacy is definitely only one piece of that puzzle of access, right? So if we were to take away economic barriers as a means to access, then education is just one component of that piece. The only way I would put it is any intervention, regardless whether that's a literacy project or interventions that would address social determinants of health, all those interventions need to address all the players in the game. Like the client is only the end user and is only one section in that in everything that we're considering. So clients, provider, institutions, various levels of government, digital solutions, manufacturers. I think every pieces within that needs to have your own intervention.
And then there's the issue, you mentioned safety. I would put trust in there as a big word. I mean, it's in every relationship we have. Trust is such a big issue. It's no different, I would imagine, in health. And so clinicians and patients, I've heard them, I've interviewed them, have been wondering, how do we establish that trust in order to move forward with better healthcare, virtual healthcare?
And I agree, that's a great question, because virtual care is here to stay. It's here to stay. Whether we offer a hybrid approach or more institutions move towards more virtual offerings in their specialties, it's here to stay, and that trust will be a huge piece in client health outcomes, right? If a client has no trust with their healthcare provider, they're more likely to omit information or to withhold information that's crucial to a clinician's assessment. And in our experience at Taibu, where we saw the need for building trust, certainly came during the pandemic, because we continued to take new clients. We did not stop. We did not start a wait list. We continued to register new clients. And previous or before pandemic, clients would come into the center and their intake would be done on site. Their first visit with their clinician would be on site. But with the pandemic, we switched to a phone encounter or a video encounter, mostly phone. And so one of the ways that we've been looking at helping to increase trust with clients is encouraging providers to use more video visits, right? So video visit might be the closest to replicating that in-person experience, because you can see someone's smile, you can see the eye contact, you can see that they're listening to you. We heard with phone appointments that, sometimes like you can't be silent. The person will be speaking, but they expect yes, or summarizing what they've said, because otherwise the next question is, are you there? Can you hear me? And so you need the communication to be as, I don't want to use the word flawless, but as efficient as possible, where the client feels heard and feels that you're listening to their needs and you're able to address their concerns. If video visits,
you know what, Tamika, there's a question. There's a question that's come in along those same lines about phone visits and video visits. And this question comes in from one of the attendees who says, for many patients, a phone visit is a poor substitute for video. And you've made that point. But here's the question. How can clinicians do more to improve the value of each digital visit?
So there is education for sure, right? So a lot of clinicians might not realize that what we would consider details or what we would take for granted play a role in a patient's ability to trust. So if you book an appointment, what we would tell our patients is the appointment is an appointment. Even though it's a phone appointment, that's the time our clinicians will call. It's not a suggested time. If clinicians try to stick to a schedule and stick to calling, even if it's not on the dot or very precise, trying to stick to a routine helps the client know that you're reliable. Other ways that we've addressed it is, like I've mentioned, summarizing and listening when the client is speaking, so that the client knows that they're being heard. For some patients, what we found is that even if in the end it's a poor outcome or the encounter was ineffective, then clinicians do have that judgment to bring their patients in. So we just want to be clear that in-person is never off the table. And so clinicians do have that judgment to bring it in. And I would really encourage any clinicians across the board to know where your patients are and meet them where they're at, meet them in terms of their comfort level. And if a phone appointment or a video is not within their capacity, then certainly an in-person would be best.
Equity is another issue Dr. Siddiqui mentioned. I know it's a big concern when we look at some of the stats with socioeconomic groups and marginalized groups. In an ideal environment, of course, digitization can improve in many ways equity, perhaps in virtual care in particular. But what is the role of virtual care literacy in combating some of those social determinants of health, if you will?
I think for us, in our experience anyhow, in my opinion, one of the biggest ways is with regards to economic stability, job security. What we used to find is patients needed to take hours or full days off work to be able to attend their medical appointments. So having that security with, I can do a video visit from work on my break. I don't need to have high absenteeism. I don't need to worry or feel guilt that I am not at work. That's one of the economic impact in my opinion. So, there's less loss of income and more job security. Education can also be impacted in the sense that if patients have digital health literacy, they're able to take on some of the management of their care. So one of the examples I would use is we implemented a blood pressure monitoring program at home. Patients who did not have a blood pressure monitor were provided one, and they had one in-person visit with our registered nurse who taught them how to use it and how to record. And then following that, they had routine periodic phone appointments with the nurse. Blood sugar management was also included in that. If patients had diabetes, we did something very similar for people who tested positive for COVID-19 with, being able to have a pulse oximeter at home. And so that remote care or having patients having taking some charge in management of their health, I think for some people will increase their health outcomes. So that's another way that digital health literacy could address.
There are lots of questions coming in, and this is racism. It's a topic we've been discussing certainly in news with various other stories, but in virtual healthcare and medicine, how do you think racism rears its ugly head?
So racism in medicine, we know, has been well documented. Discrimination in medicine and the healthcare system has been well documented by racialized groups. And in Canada, we're talking members of the Black community, of the Indigenous community. And so that perceived discrimination or experienced discrimination, I feel, will always be there, right? Like that's not something that will disappear with virtual care or with education. Again, another area that's of concern is mistrust. And so mistrust in healthcare system based on past experiences are there. Now, in terms of virtual care being able to address, there has been some preliminary research. And, one can also assume that with virtual care, if you're not seeing the patient, then we're not entering into that relationship or that interaction with implicit bias. We're not entering in with assumptions. And so for some patients with a phone appointment, they're more likely to feel less judged or to feel less discriminated against. And so that's one of the areas that virtual care could address in terms of removing implicit bias or in terms of helping to standardize care. But would
Final
it be
question
the
for
solution?
you.
Absolutely not. Go ahead.
Final question, again, coming from our attendees. I think we all want to join your yoga group just to get a t-shirt, even if that's the case, because it looks like a ton of fun, and those big smiles pre-pandemic, I'm sure, continued virtually. But some of our attendees want to know how your center was funded, because I'm sure there are programs they would like to put into their own centers or their own communities. So what's the answer to that?
And so the answer to that would come from our upper management or community and systems change manager, executive director. I know when the pandemic hit, they were applying for grants all over, grants to assist with digital access, grants to assist with food insecurity. So I'm sure they were able to partner, and they weren't able to do this all alone. But I could certainly get that information and share it.
All right, Tamika, great to have you on today in this session, and I appreciate your presentation and your passion. Thank you so much.
Thank you for having me. Thank you for helping me add to this conversation.
That was Tamika Shaw. We're going to do this now. Take a quick break, give you a chance to check out the industry showcase, maybe get another orange juice, coffee, whatever it is you're having as a beverage. So thank you to the speakers thus far. If you're listening to us wherever you are, at home, in your office, as I mentioned, click over to the industry showcase And you can use this opportunity to engage and to ask your questions to the industry representative. So another way to be, to have more participation. You can access that showcase by clicking on the tab on the left-hand side of the screen. But I will ask you one thing. Be sure to meet us back here. This is the main stage at 2:05. Until then, enjoy your conversations. We'll be back. Hello, everyone. Welcome back. I hope you had a chance to check out the industry showcase, maybe get a brief stretch. And just before we get back to our final talk and the closure of our program, I wanted to share the Canada Health Infoway Patient Family Caregiver Recognition and Inclusion Statement. Infoway, in collaboration with their patient partners, have developed this, and the statement acknowledges the critical role of patients and families and caregivers. It underscores their commitment to collaborate with them as they all work to improve the healthcare system. So that's from Canada Health Infoway, and the statement is on the website as well. So I hope you get a chance to look at that. Now, if you missed parts of the presentation, or maybe your colleagues are asking, then the recording for this event will be available by the end of the week, so you can get it then, you can go through it. So please watch for the wrap-up email. It will come to your inbox. We won't let you down on that. And the team at Infoway, I'm going to plug this word feedback once again, because you know how hard it is to get that, but certainly it is appreciated. So please complete the evaluation survey at the right side of the main stage, and then your thoughts are taken into account, and the team has time to prepare during the sessions that are still coming up to bring some of those thoughts into the next sessions. So I want to thank as well all of the sponsors for their support in making this event available to everyone. You know that sponsorship support is really crucial for any event. So here's a video. I'd like you just take a moment and watch this. Most important in any one of these partnership series sessions is your involvement. So let me just thank you for taking time out of your day. If you're in Toronto, it's blue sky and probably mid-20s somewhere. So it's a beautiful day. I hope you get a chance to enjoy some of it this afternoon, wherever you are in the country. Thank you for your involvement, for your participation, for taking time. And I would like to invite you to join us for the next session. I look forward to seeing you. It is on July 20th. And the program of that session on July 20 will be shared with you in the wrap-up email that I said will come to your inbox at the end of the week. I'm Suhanna Marchand. Thank you for your patience with me. And until I see you again, be well.